Be a struggle to see a doctor in some rural areas. For example, in Evansburg, where there's just one part-time doctor to serve thousands of residents, available just a few days a week. With limited healthcare spending and physician shortages in rural communities, some feel there's no time like now to find efficiencies. Nurse practitioners and physician assistants are two health professions expanding their scope across Canada, but not easily in Alberta because of limitations. Can this be overcome? How much of a difference could these two professions make in our province? And joining us this evening is Dr. Lloyd Tapper. He is president of the Nurse Practitioner Association of Alberta and is a nurse practitioner. And Paul Haskins, vice president of the Prairie chapter of the Canadian Association of Physician Assistants. Welcome to the show. Nice to have you in studio.
Thank you so much for having me today.
Thank you. It's wonderful to be here.
Okay, Lloyd, let's start with you. Outline for our viewers what a nurse practitioner is, if you will.
Certainly, and nurse practitioners are expert healthcare providers. We are master's and PhD prepared, and through legislation enacted in Alberta, we have the ability to assess, to diagnose, to treat. We can order and interpret any diagnostic tests. We're able to prescribe many medications. There's only two exceptions right now, and that includes controlled substances, which was passed this year. We're able to also refer to any healthcare provider, including specialists, other nurses, any part or any member of the healthcare team.
Sounds a lot like a doctor.
Very similar. Our scope of practice is approaching now 100% to what a family physician would do in the community. Yes.
Okay. Where would you find nurse practitioners in Alberta right now?
Right now, many of our nurse practitioners are working in an acute care environment, such as a hospital. And the reason for that is because there is no sustainable funding model or reimbursement mechanism for nurse practitioners to branch out into rural communities across Alberta and provide Albertans with essential healthcare services that they so desperately need.
Right, we're going to be talking about your challenges definitely in a sec here. I want to bring Paul into this, physician assistants, relatively new profession in Canada. Fill our viewers in on the difference now between this and nurse practitioners.
Well, physician assistants, like nurse practitioners, are clinicians, clinical professionals. Some of the differences is we're trained in the medical model. We're similar to a physician, and we work dependently with physicians. We're part of a dependent practice, where the nurse practitioners have an independent scope of practice. We're connected to a supervising physician. We fill similar roles, yet there's very distinct differences, and we face some of the same challenges. As PAs, we actually look at nurse practitioners here as being somewhat trailblazers for us, as they've been around a little longer than we have.
Okay, how much is there interaction between the two?
Well, right now, nurse practitioners have been implemented in Alberta for many, many years at different stages of integration. I think the PA program is very new within the province. My understanding is there are 10 PA positions right now in pilot projects, so very, very new within the publicly funded system, but they've certainly enjoyed quite some time within the Canadian military system.
Absolutely.
I believe, yes.
Okay, let's focus now on the review of rural health care in Alberta. It had called for using health professionals besides physicians, such as the nurse practitioners and physician assistants, to basically help with their full scope of practice. Lloyd, though, what challenges, let's get to those now, of nurse practitioners, what do you face?
Well, I'd like to focus on the successes first, because nurse practitioners are an incredible success story. We have nurse practitioners who are practicing right across the province, but not within the primary healthcare system. We've been practicing within Alberta Health Services, the traditional FCCs, because there was a funding model there at that point in time. And with the demise of the FCCs, that funding model disappeared. And so right now, as a primary healthcare nurse practitioner in the last 2 years, I've been able to treat patients in Rainbow Lake and other rural areas within Alberta Health Services. And there's been very few barriers, so quite a success story there. What's blocking us at this point in time is the lack of a funding model that would allow for true dissemination of NPs across the healthcare system.
And I understand many have just lost their licenses because they're not able to practice.
Yes, I spoke to nurse leaders right across the province just this morning, some within academia in 3 of the leading universities in this province, U of C, University of Edmonton, of Alberta here in Edmonton, and Athabasca, 3 incredible programs, and they're saying they're having, just one university alone is graduating 131 nurse practitioners. Many of those have no positions available, yet Albertans are going without access to care.
They're ready.
They're ready, and they're ready to give back to Albertans. Alberta taxpayers are paying for their education. They're subsidizing universities, but Albertans are not getting access to the care that they're paying for.
All right, let's bring the province into this. The Health Minister, Stephen Mandel, he has noted that more nurse practitioners would be a good answer to some of the challenges in rural communities, but admits a plan will still need to be worked out. Here's more from him on that.
Enough of them. So we really need to get in a program of increasing the training, creating new opportunities for them, and from what I've talked to various nurse practitioners, there's an issue of how we remunerate them, and so we need to straighten that out too.
So there's talk about it, but your reaction to that?
Well, I think first of all, we need to make a correction around the number of nurse practitioners. Right now, there are 413 who are registered in the province. Some are actually working as registered nurses because they can't find work as nurse practitioners. Again, one university right now this year will graduate 131. And the issue with that number is that we ramped up our enrollment 2 years ago with direction from the Alberta government that there would be a widespread implementation of FCCs, family care centres. That didn't come to fruition, but our nurses are still enrolled in those programs. They're ready to get back.
And now you're up in the air with the provincial election, seeing where everything's going to fly.
Yes.
For sure. Okay, now let's focus more now on physician assistants. Alberta is the fourth province to introduce them, following Manitoba, Ontario, and New Brunswick. And this has been done here through a 2-year demonstration project with Alberta Health Services, which began in 2013. And Lloyd had mentioned 10 physician assistants have been placed across the province, from Edmonton to Red Deer, Beaver Lodge, even Milk River, to name a few. Though, Paul, let's talk about that. Some wonder, does it make sense to have a physician assistant in these communities when there's a doctor shortage and no doctors to work along with, though?
Part of the scope of practice of a physician assistant is a negotiated autonomy. We work not independently like a nurse practitioner. We work amidst a supervised relationship. However, it doesn't have to be direct supervision. It can be, in Manitoba, for instance. I have a colleague who works in one town of 600 where there's not the population base to support a physician. And his supervising physician is one town over, a population of about 1,500. Between the two of them, they're able to provide coverage for their clients, for their population base. And yet, there's significant savings to the province, and there's improvements to access to care, which is what both nurse practitioners and PAs add.
Lloyd, some wonder in that kind of situation whether NPs would be useful instead.
Well, I'll refer to a report that was published in BC last year that it was published by the Michael Smith Research Institute in British Columbia that really looked at the value of simultaneously implementing nurse practitioners and PAs. And what they found is that in a time of fiscal austerity, when you have a care provider who's autonomous in their scope of practice, master's and PhD prepared, and you have a group of registered nurses willing to go into those programs, it's very prudent and fiscally responsible to maximize that approach. That being said, I think there's a true value for PAs in an acute care environment as a physician extender. But if you have an option of an autonomous care provider in a rural community making autonomous high-level decisions around quality of care, my personal opinion is that may be the best care provider for that role, while physician extenders may be better off in acute care environments where their knowledge, skill, and competency can be best utilized.
Paul, your thoughts?
I think in an environment where there's so many Albertans without care, without access to primary care, I think that at the moment we're looking at providing the best clinician at the best possible time and place. And if that means that we have Albertans being treated in their home communities by the right clinician to provide the care, then it's a success. And if that provider is a nurse practitioner, or if it's a physician assistant working with a physician, I think we've succeeded.
Okay, but obviously you'd like to see more of your physician assistants. Let's talk about the barriers, though. What is stopping that?
I think the biggest barrier right now in Alberta is a lack of awareness. We've been here for just under 2 years. I've been a physician assistant for about 10 years and a paramedic for about 20 before that. In Alberta, most of my patients, when I see them, and I work in orthopedics, with a Dr. Joseph Bergman. Most of my patients, when I introduce myself, go, "Oh, I've never heard of that." So there's a short education piece to go along with it. And what we found is that the PA can take some time to do teaching that a surgeon may not otherwise have. There's a continuity of care that both of our professions provide to our patients.
What about regulation issues? Is that hindering?
Going into the demonstration project, we had an understanding that regulation was not yet in place. It's a long-term project to see it come to fruition. There has to be safety for all Albertans, so all the stakeholders, from nurses to nurse practitioners to pharmacists to physicians, they all have a say in how do we ensure the safety of Albertans. So it's a process, and it takes time.
Okay, what is your group trying to do to help to
CAPA,
raise awareness and deal with regulation issues?
CAPA, the Association of Physician Assistants in Canada, is working with the College of Physicians and Surgeons of Alberta to draft the regulatory piece, and once it's at a place where the government and powers that be are satisfied, then we'll see it move forward.
Okay, so of course, up in the air. We don't know what's going to happen with the election. Could we even have a new political party in power? Who knows? So with all of that, how then can people, in the short term, long term, however long it takes, get the services that they need for healthcare when they can't get to a doctor right now?
The truth is that they're going without healthcare services. They're going without health promotion, illness and injury prevention, and in many cases, disease management services. That's reflected in the $9 billion budget that Albertans are paying to manage what is, in essence, preventable illness. And so when you look at that $9 billion budget, you know that access to the care that they need is simply not there.
Oh, sorry, I thought you were done. Go ahead.
What I would say is that this, to me, is not about an election or a particular party. This is about Albertans, and it's about Albertans who are suffering due to lack of access to essential health care.
I think that recently people have understood that rural Alberta in particular has paid a heavy price, and that they're putting in place the mechanisms to improve the system. Unfortunately, any improvement takes time, and rural Albertans are going to have to continue to reach out, to advocate on their own behalf, and to develop a system which cares for all Albertans equally.
Gentlemen, thank you very much. We will leave it there.
Thank you. It's a pleasure being here. Thank you very much.